Tara Consuelo is in the area of, she's the director of substance use disorder, suicide prevention, and outpatient social work at Detroit VA. She's been a psychotherapist with the post-traumatic stress disorder clinical team. And she relates to all of you rough and tumble guys because her old man was a Marine. So you know how that goes growing up if your dad was a Marine. So Tara, thank you for giving us the views from Detroit VA.
Good morning, guys. So yes, my name is Tara Consolino. My last name is almost as long as my title. I am the Director of Substance Use Disorder, Suicide Prevention, and a couple of other outpatient programs. So it's a pleasure to be here today. Why is it a pleasure for me personally? Because I grew up with a Marine father. For me, I came to work at the Detroit VA in order to follow that mission, which is to care for him who shall have borne the battle, and for his widow and his orphan by serving and honoring the men and women who are America's veterans. I am truly here today to be able to interact with you, engage with you, and let you know that the Detroit VA is actually here to help you in any way, shape, or form. How do we help you? In order to get assistance at any VA, you've got to register for services. And registering for services is really as easy as 1, 2, 3. You need to obtain an application. This is the VA form 1010EZ. And you can do that either by coming into a VA, going to a satellite office, or going online and printing it out. If you don't have a computer, many local libraries, if not all, do have these services available to you. The other thing is, at the Detroit VA, we've got a media center on the first floor with loud 80s style obnoxious fluorescent lighting that's really hard to miss. You can always come in there as opposed to waiting for registration, see if you can jump on those computers and see if you can get some assistance printing that stuff out that way. So what do you do once you've got your application? You would go ahead and either bring it in to the first floor in the Detroit VA. You'd park in the blue parking deck. The elevators there go down into the hospital. From there, you'd walk into the hospital, staying to the right, and go to registration. If you can't come in for mobility issues or you don't feel like driving, bad weather, living in Michigan, then you can always mail that information to the VA Medical Center, making sure that you've got copies of your DD-214, your picture ID, income verification, W-2, all of this information, so you've got it right on hand to be able to immediately register for services. If you have any third-party insurance, please make sure we've got that information as well. So once they've determined that you're eligible, this will take about 2 to 7 business days. But that being said, they'll assign you a primary care provider, and you do not have to wait 2 to 7 business days to be able to access mental health care. Once you've come in and we've gotten you a chart created in the system, you are able to come directly to our primary care mental health integration clinic, which is in the first floor, yellow section of the program, in Firm C. There we have psychiatrists, psychologists, nurse practitioners, and a variety of staff who are able to assist you with getting into treatments. The Primary Care Mental Health Integration Program, also formerly known as the Behavioral Care Clinic, is really one of those programs that's for 6 months of care or less, something that is not an ongoing illness. So you wouldn't go there for post-traumatic stress disorder. You would go there to be screened first to see if what your symptoms are actually looking like, because especially with a lot of mental health diagnoses, what presents as one way sometimes is actually something else. But from there, you would then either be seen in PCMHI, or you would then be escalated up to the mental health clinic, which is in the 7th floor of the facility, blue section of the hospital. If you're seen in mental health care, we have a walk-in clinic. We also have behavioral health interdisciplinary program teams. These are called our BHIPs. So if you're open in mental health into the Detroit VA, you automatically are assigned to a team. That team is going to be known as a color team. So a red team, a green team, a blue team, a yellow team. Those colors mean nothing. It's just a way for organization. So that way I know that I'm a part of this pod, which might be the red BHIP. Each team has psychiatrists, social worker psychotherapists, social worker case managers, psychologists, SUD psychologists or SUD social workers who are psychotherapists, nurses, addiction therapists, and peer supports. So what does that all mean to you if you're on that team? So let's start with what some of these interdisciplinary people, what do they do? What does that mean that they're a clinical social work case manager? If you're seen by a clinical social work case manager, those services provided to you consist of coordination of care between providers, between the doctors, between the nurses, between chemical dependency services, possibly between the Veterans Justice Outreach individuals that I'll talk about at a later time. They also help you with linking to services that you might need, linking to programs that you might not even be aware exist. Advocacy, advocating and assisting with you, getting into those programs. And then monitoring you to make sure that you're as stable as you need to be, that your loved one is as stable as they need to be able to move forward into different programs and achieve a life that you want to live. And then supportive counseling. Supportive counseling is different than the psychotherapies. Psychotherapies are provided by either doctoral level psychologists or master's level clinical social workers. Within the mental health systems, master's level social workers and doctoral level psychologists are interchangeable when they're a psychotherapist. They provide evidence-based psychotherapies that I'll outline later. The difference between the psychologists and social workers within the VA system really comes into neuropsychology, which is the testing to see if someone's suffering from dementia, testing for a traumatic brain injury, things along those lines. All right, SUD. SUD is substance use disorder services. This is also known as chemical dependency. For the Detroit VA, we have open access for chemical dependency services. What this means is, at any point of time, you do not need a referral to come in and be seen. Monday through Friday, 8 a.m. to 3 p.m., you can walk up to the 7th floor and be seen usually within about 20 minutes, which I'm pretty proud of my team for that, except on Thursdays. Thursdays, I have to admit, we run a little long. But that's just kind of a warning. We're still there and we're still open Monday through Friday, 8 a.m. to 3 p.m. The services that are available in that program are opioid treatment programs for people suffering from opioid dependence or addiction, Suboxone treatment, which is a specific medication that is also used to treat opioid addiction. The OTP is actually the methadone program. The STP is the Suboxone treatment program. Which program would you want? That's between you and your physician to discuss. There's different lifestyle factors, there's different medical issues, things that go along with that. So you might come in and request one program, or you might recommend that your son, your daughter, your friend who you're bringing in is requesting one program, and they might walk out with a different one, just depending on their specific needs. ORP is our outpatient recovery program, which is an ongoing maintenance program for support in psychotherapy. And then we also have our IOP and SIOP programs, which is our intensive outpatient program and our semi-intensive outpatient program. What those are a step under residential level. So maybe somebody has a job and they can't go inpatient, or they've got family, or they've got dogs and cats that they just can't leave to go into a residential facility. That's where we help with beefing up that care that would be available on an ongoing basis to make sure they can get clean and sober. The Veterans Justice Outreach social workers are clinical liaisons who coordinate the care between the clinicians and the courts. So their mission is to really avoid unnecessary criminalization of high-risk veterans. So that way veterans who might be suffering from a chemical dependency or a mental illness, or they've just been given a bad deck of cards ever since getting out of the service, and they need somebody to advocate for them, to try to get their life on track and navigate the court system, that's what our Veterans Justice Outreach social workers do. Psychotherapists. The psychotherapists that are involved in the chemical dependency program and the mental health program, all under one umbrella. We're all one team. So these PhDs and LMSWs have all been trained in a variety of evidence-based practices. So what are these evidence-based practices that I'm talking about? What is evidence-based psychotherapies? Long story short, there's a variety of psychotherapy. Sometimes there's talk therapy, which is kind of more of a, just a supportive counseling. These are practices that have been shown to be effective for even the most complex mental health conditions. For the VA, the reason the VA really stands out as far as what we do in mental health is because our practices that we've got clinical centers of excellence around the country that specifically study military psychology and the effects that certain aspects of life have on veterans. So our psychotherapies are tailored specifically to a veteran. The evidence-based practices that we offer at the VAs, both here in Ann Arbor, are cognitive processing therapy and prolonged exposure therapy. These are kind of the gold standards for post-traumatic stress disorder. We also offer cognitive behavioral therapy for depression. We've got the ACT and IPT for depression and anxiety. We've got the social skills training for the severe and the severe mental illness diagnoses. And then we've also got cognitive behavioral therapy for substance use disorder. There's also seeking safety, which is a practice on really kind of working with somebody to see how they can become their own case manager to manage their symptoms and to be able to navigate the healthcare system. Outside of individual psychotherapy, we have a ton of groups. Our groups that we offer range everything from anger management to anxiety and stress management, depression, developing skills to improve your mood, grief and loss, again, post-traumatic stress disorder. But all of these are offered in a variety of venues depending on what part of your program you're in. So the thing that I often hear working in mental health is that there's no cure for a particular diagnosis, that somebody is absolutely, their life is over. Why do we even do what we do? And I have to tell you that when we're talking about mental health, we really have to break that stigma down and look at it as we would other physical health diagnoses, such as diabetes. When somebody's given a diabetic diagnosis, it's not a death sentence. Okay, what do we need to do to manage that particular diagnosis? And the same thing is true with mental health. The difference is when we're talking about mental health is that the ways in which we manage it can be a little bit more uncomfortable. We've got to be honest with ourselves, what's going on, and sometimes that means taking a walk back in our history to discuss some of the things that are not the most comfortable reliving. So therapy, it's hard. It is absolutely hard. But I want you to think of it like a metal ladder. So if the life that you're living right now or the symptoms that you're experiencing right now are horrific and you're miserable and you are not the person you want to be, you are not the man that you want to be, and you are not the father you want to be, the wife, the partner, what have you. If you look at your life as if you are in flames right now, and you look at therapy as if it's a metal ladder that is reaching up out of the flames, you touch that ladder, it is going to be hot. And there's going to be times that you're like, nope, I'm out. All right, our suicide prevention coordinators, both at the Detroit VA and then also the over 300 that we have across the nation, are responsible for training staff, for doing outreach events, for working with veterans, their caregivers, coordinators on, decreasing suicidal ideation and talking about what it means when somebody is threatening suicide. They provide guidance on best practices for the prevention of suicide, and they provide ongoing trainings and outreach. So if there's anyone in this room that have different coalitions that you're a part of or community action work groups, feel free to get my card, and we're always more than happy to come out and help discuss how the VA is working to prevent suicides. So nationwide, we have done a public health approach to decreasing suicides. And this is important because the reality is that, okay, so the number is down to 20 suicides a day of veterans who are killing themselves. 20. If that is one veteran a day, it is one too many. If that is you, if that is your son, your daughter, your spouse, that is too many. And the problem is that we as the VA can't treat who we don't see. I am the first to admit that, I read the most sensational news articles that I can find. If I see something that's bright and shiny or depressing, I go right for it. And honestly, a lot of people do, and the media knows it. So when they see, these horrific things that are allegedly happening in some of these VAs, which thankfully have not been in the state of Michigan, believe me, I'm the first to go read to it as well. But when they keep doing that, they're really negatively impacting the system as a whole, which is phenomenal, and which, honest to God, out excels other areas, specifically in mental health, that we can't get people to come in and care for them. So out of the 20 veterans a day who are killing themselves, only 6 are seen in VA, and of those 6, only 3 were seen in mental health. Please, if you don't need to hear me speak right now, but you know somebody who does, then honestly, pass our card around, pass my card around, and encourage them to go to the Detroit VA. I just had a staff come to me the other day and say to me that she was having an issue with her son, who was an adult son, and she needed some help getting him into some mental health care. So she asked me where to go, and I helped her navigate her insurance, found out that it was Henry Ford. So I'm like, okay, great. Henry Ford, excellent healthcare system. So we call Henry Ford together, and the behavioral health to get in for psychiatry would not give her an appointment because they were booked so far out that they weren't even taking names. Their recommendation to her for getting her son care was to call back every week to get an appointment to see if an opening had come up. You're not going to get that in the Detroit VA. Whether it's Detroit, Ann Arbor, Saginaw, I don't even care. You're not going to get that in the state of Michigan. You are going to get registered and seen same day. And here's the deal. If for some reason it happens at any of the VAs where you're like, that didn't happen, maybe somebody had a bad day, or I don't know, they put their dog down, came into work, and you bore the brunt of it. Doesn't make it right, not making excuses, but I'm just saying things happen. We have patient advocates and patient liaisons that you can then go and say, you know what, I was not treated correctly. I need some help. And if they can't help you, we have supervisors and managers. Please, do not let one bad experience deter you. Because if you have a bad experience and you share that bad experience, at some point, another veteran who needs our care is going to hear it, and they're not going to come in. And that does not save lives. So what can you do, or what can someone do for you if you are one of those people who know somebody who is possibly experiencing suicidal thoughts? Remember this statement. Is the path warm? Is somebody suffering? Ask them about if they're having any ideation, if they're having any threats. Think about substance abuse. If there's any substance use or abuse, when we are under the influence, we make more impulsive decisions. Is somebody expressing purposelessness, having a lack of hope, having no reason for living? Are they constantly anxious, agitated, not sleeping? Do they feel trapped? Are they in a situation where maybe they were less than honest and they're not able to dig their way out? They don't know what to do, resulting in them feeling hopeless? Have you been seeing that they've been withdrawing? Have you been withdrawing? Have you not seen them for a while? Is there any anger, recklessness? Are they driving their motorcycle faster than they should? Are they drinking and mixing pills? Are there dramatic changes in their mood? How are they? Have they become a different person? When we're talking about mental health, when we're talking about the Detroit VA, when we're talking about the VA system as a whole, really, in order to work together to be able to save lives, we've got to work together to be there for each other. So he knows someone who, when he comes into the facility, has to be escorted by the police. And this, he has said that it's come up because his friend, brother, person points. So there's always three sides to every story. Your side, my side, what really happened. And I do not know your brother. But I do know that safety of our veterans and safety of our staff always has to come first. And so if there has been a situation where a veteran has been flagged as high risk for disruptive behavior, where there has been a safety issue associated with them, they are then identified to then meet with the police prior to coming up for both the safety and staff involved. Again, there's an entire committee that works when we've identified veterans like that, and we do so nationally for the safety of all those involved in that veteran's care and the veterans who are also sitting next to them in the waiting room. I believe most of you in here are veterans or you know a veteran. And you know, when you're signing out and you're getting off station and you're getting out, it's kind of just check, 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 get me out of here. So there's two things that I can say to you. One, we have a transitions care management program at the hospital that if he or she, any of your returning veterans that you know, need some assistance, you can walk in and be directed, and they have a pager where if you go to registration, they will then contact a social worker to come to you. However, sometimes people are like, forget it, I don't want the VA, I'm not going to the VA, I saw bad experiences with my parents or older siblings. That being said, that's where the VA has a service called Coaching into Care. Coaching into Care, if you Google this, you can find the website and the phone number. But Coaching into Care, I've had remarkable feedback on. Things that other psychologists and social workers did not even think to tell their own family members. They are specialists really in engaging and supporting family and friends of veterans. So they are based, I believe, out in Colorado. So it's a website, it's a council of people manning telephones, there's texting. They are outreach in the way that if you contact them, they will provide that information, but they don't come and do presentations such as this. You can always, when in doubt, the Veterans Crisis Line is also an excellent number. You call up, you press 1, you say, I'm not in crisis, but I honestly don't know who to turn to ask for some of these resources. Can you put me in touch?
Why don't you introduce your colleague? That was one of my notes I made.
Absolutely. This is Miss Tina Sawicki. She is, come on, stand up.
Stand up.
Sorry. Okay. That is Miss Tina Sawicki. She is one of the suicide prevention coordinators that is based out of the Detroit VA. She is one of the women who you might be connected to if you make a crisis call, or somebody who will then coordinate the care if you've ended up in a crisis and at a local hospital.
But VA has a robust program on addictive behavior in general, doesn't
Correct.
it? I had the opportunity to interview one of your clinicians in the VA system who was an expert in gambling addiction.
Yes.
To find out that veterans have a high gambling
Correct.
addiction rate.
Correct.
And went, I just saw some guy lean to his buddy and say, see? That's why he loses in poker all the time. But there's apparently a high correlation between veterans and gambling.
Very much
and
so.
VA has programs. So can you just talk
We do.
on the broader
Yes.
addiction
So,
opportunities?
very long story short, like I said, if you or someone you know has a gambling addiction, a sex addiction, addiction to a chemical, so on and so forth, you can come on in to the 7th floor, walk in. What we do is we do a triage with you. We will screen you. We will create a treatment plan. We will do an intake. You will then be set up with an individual psychotherapist and groups. And we are able to absolutely work with you, your schedule, to figure out what you need, what the program is, and we have specialists that really range the gamut for any of those concerns. Eating is also considered an addiction. Food addiction. With that, we might not see you in our chemical dependency program, but we will see you. We will make sure that you will be seen by a individual therapist and or groups as we see fit.